Strength-based nursing and nursing needs theory, a comparison. Throughout this presentation, we will be exploring two nursing theories, the contemporary theory of strength-based nursing and the classic nursing needs theory, and how they can apply to a single nursing scenario. Strength-based nursing is a contemporary nursing theory first published by Dr. Laura Gottlieb in 2013. As much of Dr. Gottlieb's academic and scholarly career has taken place at McGill University in Montreal, she states that her theory is based largely upon the McGill model of nursing. Strength-based nursing is unique among nursing theories because it focuses solely on the strengths of an individual or family unit and encourages nurses to facilitate environments of healing and wellness by focusing on strengths. Dr. Laura Gottlieb is currently a professor at the Ingram School of Nursing at McGill University in Montreal. She is the former editor-in-chief of the Canadian Journal of Nursing Research, and she is the current nurse scholar in residence at the Jewish General Hospital, a McGill University teaching hospital. As stated earlier, strength-based nursing focuses on the strengths of an individual or family unit. Strengths can be biological, social, or psychological in nature. An example of a biological strength is an individual's strong immune system, or their heart's ability to compensate for a decreased BP with an increased heart rate. A social strength could be having a strong family unit for a postpartum mom to go back to, or even a strong web of social supports geared towards new mothers in her community. And an example of a psychological strength could be a trauma victim's desire to start rehabilitation as soon as possible. Gottlieb attests that focusing on an individual's strengths is actually the basis of nursing values such as empowerment, health promotion, self-care, and collaborative partnerships. Gottlieb also promotes the idea that often, if we know how to identify them, there are more things going right in a given scenario than going wrong. Nursing needs theory is a classic nursing theory published by Virginia Henderson in the mid-20th century. It was largely influenced by the publication of Maslow's hierarchy of needs in 1954. In her theory, Henderson identifies what she believes to be the 14 fundamental human needs. Nursing needs theory indicates that the role of the nurse is to rectify any deficits in those 14 needs through either substitutive actions, doing for the person, supplementary actions, helping the person do, or complementary actions, doing with the person. Virginia Henderson is often referred to as the mother of American nursing and as the Florence Nightingale of the 20th century. She completed her initial nursing education at the Army School of Nursing at Walter Reed Army Hospital. From there, she completed an MA and was a member of the faculty at the Schools of Nursing at both Columbia University and Yale University throughout her career. The 14 fundamental human needs as identified by Henderson in her nursing needs theory are: breathe normally, eat and drink adequately, eliminate body wastes, move and maintain desirable postures, sleep and rest, select suitable clothes, maintain body temperature within a normal range, keep the body clean and well groomed, avoid dangers in the environment, communicate with others, worship according to one's faith, complete work in a way to experience a sense of accomplishment, play and participate in recreation, and satisfy curiosity through learning or discovery. Now, let's take these two nursing theories and apply them to a scenario. This is Sylvia. She is an 83-year-old female who was brought to the emergency room via EMS for a probable stroke. Her neurological status is altered, and her Glasgow Coma Scale reading is 7 out of 15. She withdraws from pain on the right side only. Her right pupil is reactive. She appears to have vomited, but the nurse must assist with suctioning to clear the airway. The ER physician decides that she must be intubated prior to being flown to a stroke center via an air ambulance service. After being intubated and hemodynamically stabilized, two nurses work together to change Sylvia out of her soiled underwear and perform mouth care around the ET tube, taking care to roll her onto her dependent side for mouth care. Sylvia's husband, Dean, is present in the ER. He asks good questions and holds Sylvia's hand once she's been stabilized and awaits the air ambulance team. Let's first look at the scenario from an SBN approach. Despite the fact that the situation seems quite dire, Sylvia has a number of strengths we can focus on. First, she lives in a town that has access to EMS services and an ER staffed with at least one physician, and a nurse who are capable of performing advanced life-saving measures. These can be considered social strengths. From what we know of Dean, her husband, he could also be considered a social strength. It's likely that throughout Sylvia's recovery, Dean will also contribute to some of the psychological strength for Sylvia. The scenario also identifies several biological strengths. Despite her left-sided weakness, Sylvia's right-sided function seems largely preserved. In the future, this will be a strength that will drive much of her nursing care and rehabilitation interventions. Even at present, the nurses are capitalizing on that strength to prevent poor outcomes by rolling her onto her dependent side for mouth care. Now let's look at the scenario from a nursing needs theory approach. Because of the situation, it is likely that at the present, most of the nursing interventions will be substitutive. We're doing them for Sylvia. If we were to look back at the fundamental human need number 1, we'd know that according to Henderson, it's to breathe normally. In this scenario, Sylvia's compromised neurological status indicates that she's not stable enough to ensure that she will continue to protect her own airway, so the decision is made to intubate. While the actual intubation will fall upon the physician, it is likely that the nurse will need to set up and manage the ventilator, and in the event that Sylvia becomes difficult to ventilate or the ventilator malfunctions, the nurse will be required to literally take over the task of breathing for the patient through the use of a bag valve mask device. There are other deficits in the scenario we can identify according to the 14 fundamental human needs as well. Sylvia requires assistance to change her clothes and aid with bowel and bladder function, tasks that are being taken on by the nurses, and it is likely that she will require extensive assistance with repositioning for quite some time. Both Henderson and Gottlieb provide valid and thought-provoking theories to describe professional nursing practice, and despite their stark differences, both can accurately be used to describe the nursing scenario we went through. This further denotes that any single nursing theory falls short in actually describing the role of nurses, and they are best used in conjunction with each other to conceptualize the nursing profession.